You are welcome to this presentation on house types, settlement patterns, infrastructural and physical distancing measures during the COVID-19 by Adedayo Ayoola of the Department of Architecture, Federal University of Technology, Akure, Nigeria, and Amira Osman of the Department of Architecture and Industrial Design, Shawani University of Technology, Pretoria, South Africa. Introduction. The COVID-19 pandemic is spreading globally at an unprecedented rate, thereby prompting diverse mitigating measures to reduce the spread. As of September 2020, it had reached 213 countries with 28,488,844 confirmed cases and 916,296 deaths recorded, according to WHO 2020. In Nigeria alone, 55,829 cases and 1,075 deaths have been recorded during this period. Safety measures. Literature revealed that contracting the virus is majorly through physical contact. Diverse mitigating measures adopted to reduce the spread of the virus are social distancing, isolation and quarantine, lockdown, curfew, restriction on movement, masking, and other hygienic practices. These measures have been found to significantly reduce the spread and flatten the curve. Cities and diseases. According to Klaus 2020, disease shapes cities. The coronavirus is an opportunity to study the relationship between design and public health. The crisis brings to light the impossibility for large proportions of population to follow the requirement for reducing the chances for infection, specifically isolation and frequent hand washing. Shelter at home and consequences. The COVID-19 pandemic induces so many effects on societal and residential lifestyle. Social life and interactions are reduced. Households experience drastic shifts and changes in their use of spaces, income loss and economic hardship, as well as adverse effect on health and well-being. The physical distancing and social distancing is designed to reduce physical contact between people who may either be infectious or are yet to be identified. Physical distancing in informal settlement is very difficult to achieve due to issues relating to neighborhood structure and pattern. Houses are substandard and in poor condition. Houses are not equipped with basic infrastructure, and where available, it is shared. However, homes are also overcrowded, making it uncomfortable and difficult for social distancing. Methodology. 4 residential communities in the core of Akure, Nigeria were purposely selected based on perceived high level of poverty. 211 houses were selected for this study, and heads of household in each of the houses were basic focus of questionnaire administration. Question on safety measures, house types and characteristics, settlement patterns, level and adequacy of infrastructure, and changes people created in their own spaces to reduce transmission and the delay of the spread were adequately investigated. Result of findings. House types and characteristics. 4 main house types were found evident in the neighborhood. Rooming apartments, 77%, flat bungalows, 99%, story buildings, 10.9%, and bungalow single family, 2.4%. Majority of the respondents are renters, while 39.8% are homeowners, and a few others live freely in family houses without rent. Majority of the houses have between 5 to 6 rooms or more and occupied by an average of 4 to 5 households and inhabited by an average of 16 to 20 people. Most houses have pit latrines and shared among households with no regular source of water supply. Awareness of COVID-19 and personal behavioral responses. Majority of respondents are generally aware of the outbreak of the coronavirus. 98.1% of the respondents altered their behavior to reduce the risk of contracting the virus. Majority of respondents made changes based on health concerns and fear of contracting the virus. Behavioral changes includes personal hygiene, 98.1%, extra house cleaning, 76.1%, physical distancing, 73%, and changes in functional use of space, 23%. However, others made few adjustments to their household composition. Household coping strategies and survival mechanism. People relied on support from family members, 36%, friends, 30.8%, and from religious institutions and social groups, 27.5%. Only 3.8% of the respondents received support from government. 38.1% received support in terms of cash, while 56.9% of the respondents received food items. Other coping strategies adopted by household includes reduction in food consumption items and non-food consumption items, sales of personal property at 11.4%, and others engage in extra income generating activity. House types and safety precaution measures. Several safety measures were practiced by the respondents, such as personal hygiene, 98.1%, extra house cleaning, 77.3%, restriction of movement, 14.7%, change in functional use of space, 36.5%. The practice of personal hygiene and extra house cleaning was found highest in all the house types, and physical distancing and isolation was considered lower among the house types because many families shared amenities and living spaces. The Spearman-Rio correlation was used to test for significant relationship between house types and safety precaution measures, and the model revealed that there is a significant relationship between 5 of the safety precaution variables: physical distancing, masking, isolation, restriction on social interactions, and changes in functional use of space. Summary and conclusion. Most of the houses were occupied by an average of 4 to 5 households and inhabited by an average of 16 to 20 people, hereby showing that those spaces are overcrowded. Services were either non-existent or shared, and awareness of COVID-19 was generally high. Several preventive measures were adopted, and majority of the respondents confirmed they altered their behavior to reduce the risk of the virus. House types have significant influence on the practice of safety measures in the study area. Conclusion: government should give more support for households to mitigate the social and economic challenges experienced during the pandemic. Policymakers and government needs a better understanding of the impact of the pandemic on the living environment with a view of informing better responses to curtail the spread of the virus in different settlements, house types, and income groups. Thank you for listening.